Thank you, Madam Secretary, for being with us. I have some specific questions to ask about some of the, essentially the promises that the President made to the American people as he was rolling out the idea of the Affordable Care Act. One of those promises being, if you like your doctor, you can keep your doctor, period. Can you commit to the American people today that this is true and that they will be able to keep their doctor?
Congresswoman, I think that, as you well know, in the private market, networks change on a constant basis. The President is not overtaking the private health insurance market. There is nothing in the
You are absolutely right, but that is
would
the
cause
promise,
a person to lose a doctor.
the promise that was made to the American people, so that this piece of legislation, which is now law, was passed, was that they would be able to keep their doctor.
Again,
yes or
most
no?
consumers will have the opportunity to pick and choose a network that continues their doctor. There's nothing in the law that has their doctor lost to them.
There is nothing in the law, but there are networks that are now very narrowed as a result of the law. Is that not true? There are medical
insurance
centers.
companies make network decisions day in and day
but
out.
That was
Any
not that is
company,
not the promise that the President made. Did the President not make that promise to the American people?
This is the private insurance market that changes networks on basically a daily basis.
Then why in the world, Madam Secretary, did the President make that promise to the American people?
I think the President was trying to assure people that the law did not require them to lose their doctor. They have a network.
No, I don't believe that he was reassuring the American people that they would lose their doctor. I think he was reassuring the American people that if this law passed, that they would be able to keep their doctor. So therefore, today you are basically saying no, that this is not the case.
I'm saying that there is, again, this is the private insurance market where insurance companies develop networks and change them on a regular basis.
And the American people will be able to keep their doctor if they pay more, according to Ezekiel Emanuel.
They can choose a network where their doctor is available. They can choose a plan where their doctor is not available based on the kind of premium, the kind of deductible, the kind of situation.
Well, I see that my time has expired, so thank you, Madam Secretary.
The Chair thanks the gentlelady.